Okay, thanks everyone for joining us here this morning. I'm joined by Deputy Secretary Kate Matson, Professor Pat McGorry and Gus Cleland, who's the CEO of Mental Health Victoria. So I'll run through the daily stats. Then I've got a very special mental health announcement. We'll hear from Pat and Gus, and then Kate to round us off, and then happy to answer all of your questions. So in terms of the COVID message and stats for today, there were 445 cases yesterday, all of those locally acquired. 129 of today's cases are linked to known outbreaks and cases. The rest are under investigation. Sadly, we have had 2 deaths reported, a man in his 20s from Hume and a woman in her 80s from Brimbank, and we extend our sympathies to the families of both those Victorians. Very, very sad. We now have 3,799 active cases. 85% of all active cases are under the age of 50. 563 are aged under 9, 647 aged 10 to 19, 906 aged in their 20s, 683 aged in their 30s. In terms of tests and vaccines, 36,615 vaccines were administered at our state hubs yesterday, and we hope to come very close to meeting our 1 million dose target tomorrow. We have 36,000 shots to go to reach our target of 1 million doses. We're also inching closer towards the 70% first dose target, with almost 67.5% of Victorians aged 16 and over having 1 shot. And yesterday there were 42,694 tests processed. Sadly, 158 people are currently in hospital with COVID-19, 45 are in ICU and 23 are on a ventilator. Of those cases who were in hospital yesterday, 91% were not vaccinated, 8% were partially vaccinated, and just 1 person was fully vaccinated. So we'll hear from Kate in a moment, but I would like to take you through a very exciting mental health announcement. And as I said, we'll hear from Pat and Gus and then from Kate. So we know that throughout this pandemic over the last 19 months, some Victorians have been really struggling, whether that's through isolation, whether it's financial stress, whether it's illness and indeed loss of life or loss of a loved one via COVID. This has been an incredibly difficult, unprecedented time, and many Victorians are struggling with their mental health and well-being. This has been exacerbated by a mental health system that we know is broken. We had our nation's first and only Royal Commission into mental health. And over the last 6 months or so, we have started our reform. This is a 10-year reform, which began with a $3.8 billion investment in the May budget to fix from the ground up our broken mental health system. But at the same time, we know that the pandemic is having a particular impact. And over the last 19 months, we've invested more than $225 million in a whole range of initiatives to support Victorians who are struggling with their mental health and wellbeing as a result of the COVID-19 pandemic. Whether that's clinical support to tackle the waiting list in terms of our headspace centres, whether it's support for eating disorders Victoria, whether it's direct mental health supports into our school system. $225 million to date. But we're always looking at what more that we can do. How can we support a workforce that is already stretched, that is already fatigued by the pandemic? How do we find more capacity to support Victorians where they're in need? So we've had many discussions with Professor Pat McGorry, with Gus Cleland at Mental Health Victoria, with Mind Australia, with a range of community health organisations, and I really want to shout out today to our community health organisations for their innovative ideas, and that's what today's announcement is all about. So today we're announcing a $22.1 million package of additional mental health support. The big element, $13.3 million, will deliver 20 pop-up community mental health services, 8 in regional Victoria, 12 in metropolitan Melbourne, and we'll have them progressively up and running from the end of this month. So progressively, we'll start at the end of this month and progressively open them. There'll be a 1300 hotline number and a dedicated website, and we'll have details of that over the coming days. But this $13.3 million investment, 20 pop-up clinics right across metropolitan Melbourne and regional Victoria, will deliver 90 clinicians and 93,000 hours of care, counselling, wellbeing checks, referrals in the community, supporting many thousands of Victorians and reducing the impact on our emergency departments as we continue to tackle the impact of the pandemic. Importantly, this is a free service and it will be open for all. This is a really exciting initiative. We're finding capacity within our community health network, and again, I want to thank Gus, Pat, Mind Australia and other organisations who are coming on board to help deliver this. We're also providing additional support for specific groups that may be at higher risk. So out of this $22 million package, there's $4 million for our Aboriginal controlled organisations to provide additional care for Aboriginal and Torres Strait Islanders. There's $1 million to expand the Triple P parenting program, and I'm really excited about this. This is about supporting parents and carers of children who are suffering from anxiety. This additional boost will support more than 20,000 families across Victoria. There's support for the Royal Children's Hospital, support for Vic Health, and there's $1.2 million to boost the capacity of LGBTIQ+ community organisations. So all up, a $22 million package of additional support on top of the $225 COVID funding we've already provided, and on top of the $3.8 billion mental health billion-dollar budget back in May.